So, good day ma'am. I'm Glazelle Mae Vergara po from BSN 1E Group 2. So, today po I'm going to perform my written demonstration of the assessment of the thorax and lungs. So, the equipment needed are examination gown, a gloves, stethoscope, skin marker, and metric ruler po. So, for the preparation, explain the structures and functions of the thorax and lungs, and describe the proper client preparation, and also identify the age-related changes associated with these systems. In prior to do this procedure po, I'm going to introduce myself, verify the client's identity, explain to the client what I'm going to do and why it's necessary, and how the result will be used. So good day sir, I'm Glazelle Mae Vergara po from your student nurse po for today from CSPC. So, before we start po, can you please state your name, age, and birthday for verification lang po?
I'm Vergara. I'm 20 years old. And birthday is March 31, 2000.
So today po sir, I'm going to assess your thorax and lungs po. So these procedures po involves looking and feeling, tapping, and also listening to your chest po to check how your lungs are working po. So I will now start po from the back, then move to the front. So sir, hindi lang po ko ng permission nyo po. I'm going to inspect and touch certain part of your body. Ako na po ba? So if any point po na makaramdam po kayo ng pain or discomfort while we do the assessment, please let me know na lang po. So, perform lang po ako ng hand hygiene po. Tapos, provide ko lang po kayo ng privacy. And provide ko lang po kayo ng privacy by closing the curtains. Assume na lang po. Tapos, I'm going to gather the equipment. So I'm going to ask you po some questions. So, do you have any history po of asthma po?
Nothing.
Meron po ba kayong ubo ngayon?
Wala.
Difficulty breathing po?
Ano?
Chest pain po ba?
Wala.
So, you can remove na po your para makastart na po tayo. Okay, so I'm going to use my bare hands po for palpating and inspecting po. So, first, inspect for the shape and configuration of the chest wall and position of the scapulae. So, sit straight po and can you do this first? Tapos bend po kayo ng konti. Check ko lang po. So, okay. So, the chest is symmetric and elliptical in shape. The scapulae are also symmetric and at the same level. So, next po, can you inhale and exhale? So, no use of accessory muscle, noted. So, now I'm going to inspect the client's positioning, noting the posture, ability to support weight while breathing. Okay, so client is sitting upright and comfortable, so able to support their weight without leaning. So now palpate for the tenderness and sensation with my bared hands po. So, do you feel anything po? Okay. So, upon palpating, the skin is smooth, no tenderness, and no masses, with quite few moles lang po. Next, I'm going to palpate for primitus using the ulnar part of my hand while the client say 99. So, sir, can you say 99 po?
99. Right.
Okay, so the vibration are felt equally po and symmetrical on both sides. Next, I'm going to palpate for chest expansion. So, I'm going to place on the posterior chest wall with my thumb at the level of the T9 or T10 po, and observe the movement of the thumb as the client takes deep breath. So, sir, I'm going to deep breath po kayo, sir. Okay, so upon palpating, so the chest expands in symmetrically and thumbs move apart equally din po. So next, I'm going to now percuss for tone, starting at the apices above the scapulae and across the tops of both shoulders. And then percuss the intercostal space across and down, and also percuss to the lateral aspects of the bases of the lungs, and also compare the sides. I'm going to start with percussing. Okay, so the sound is resonant or hollow all over the lungs fields and equal on both sides with no dullness or hyper resonance noted. So next, I'm going to percuss for the diaphragmatic excursion. So I'm going to percuss to find the lower border of the lungs on full expiration and full inspirations and measure the distance. So I'm going to use a marker and also a ruler. So sir, inhale po kayo and then hold po. Then okay na po sir. Inhale, exhale, hold po. So the measurement are 3 centimeters, so it is indicate that it is normal. We're now going to auscultate for breath sounds, noting the location, and auscultate for adventitious breath sounds. Now I'm going to clean the diaphragm of the stethoscope. So now I'm going to start auscultating. Inhale, exhale. 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 Inhale. So the breath sounds are clear, no abnormal or adventitious sounds noted like whistles or crackles. Next, I'm going to auscultate for voice sounds over the chest wall. So first, I'm going to do the bronchophony. So sir, can you say 99 po? 99.
99.
Okay. So the sound is muffled and not clear po, indicating that is normal. So next, I'm going to perform the egopony po. So can you say E po, sir? Okay. So sounds the client say is E, not A po. So indicate that it's normal. So next, I'm going to test the whispered pectoralici. So, sir, can you say 1, 2, 3 po in whispered po? Mabulong lang po, sir. Okay po, sir. Okay, so the sounds are faint and muffled, indicating that is normal. So we're now done assessing the posterior thorax. Next, I'm going to test for the anterior thorax naman po. So now I'm going to proceed on the anterior thorax. So sir, can you please place on the camera? Please on the camera po. So we're going to start for inspecting for shape and configuration to determine the ratio of the anterior posterior diameter to transverse diameter. Okay, so the chest is elliptical. The AP diameter is less than the transverse diameter. So next, inspect for the position of the sternum from anterior and lateral viewpoints. So so that sternum is in midline, straight and not protruding or depressed. So inspect for the slope of the ribs from anterior and lateral viewpoints. So the ribs slope downwards towards the midline, approximately 45 degrees. So now I'm going to inspect for quality and pattern of respiration, noting breathing characteristic, rate, rhythm, and depth. So the respiration are quiet, effortless, regular, and normal in depth. So next, I'm going to inspect the intercostal space while clients breathe normally. Okay. So the space are flat or slightly depressed, no bulging or retractions noted. Now, breathing is done by the diaphragm and intercostals only, no use of the neck or shoulders muscles noted. So using po ulit my bare hands, I'm going to palpate for the tenderness and sensation. So sir, do you feel any pain po? So no tenderness noted, pain or numbness. So next, I'm going to palpate for the surface characteristics such as lesion or masses. So upon palpation, the skin is smooth, intact, and free from lesions, lump, or masses. And I observe also there are quite few moles, and it's normal naman po. So next, I'm going to palpate for primitus while the client says 99. So, can you say 99 po?
99, 99, 99, 99, 99, 99.
So vibration are felt equally and symmetrically on both sides. So next, I'm going to palpate for chest expansion by placing my hands on the anterior lateral wall with my thumbs along the costal margins and pointing towards the xiphoid process. Breathe in, breathe out po kayo, sir. Okay. So the hands and thumbs move apart equally and symmetrically. So now I'm going to percuss for tone above the clavicles and then the intercostal space across and down, comparing the sides. So, upon percussion, the sound is resonant over the lungs tissue. Dullness is now normal over the heart areas. So, lastly, I'm going to auscultate for breath sounds, adventitious breath sounds, and voice sounds. So, I'm going to just clean all of the diaphragm of the stems. Okay, so for breath sounds, it is clear and equally bilateral. And for the adventurous sounds naman, none heard, no crackles po, whistles or ronkai. And for voice sounds naman po, the sounds are muffled and not clear or distinct. So we are now done doing the assessment. So, sir, thank you po for your cooperation po. You can now test po. So, back to na po yung comfortable position. So, now I'm going to perform hand hygiene and remove the discard the materials used. So, I will now summarize the findings. So, sir, upon inspection po, your chest shape po is symmetrically with normal 80A to transverse diameter ratio po. And respiration po are regular and effortless with no use of accessory muscles or retractions. And upon palpation naman po, no tenderness, masses, lesions or crepitations are noted po. Then, for the chest expansion naman po is symmetrically po, and tactile primitus po is equally bilateral din po. So, upon percussion naman po, the resonance is here throughout the alt lungs fields po, and for the diaphragmatic excursion naman po is within normal limits. So, for the upon auscultation naman po, the breath sounds po are clear and equal bilaterally with no adventitious sounds, and voice sounds are muffled and faint. So, next I'm going to document po the findings. Okay, so that's conclude po the procedure. So, thank you po for watching po, ma'am.